Speaking of this picture, we always like to share as we join on these calls the purpose of our LCs, our learning collaboratives. So if you can take a second to sort of read through those, the biggest thing being that we are really hoping to have some meaningful engagement today, and we would love to have your active participation. There will be a chance to ask questions at the end of the presentations, after each presentation, and then also at the end we'll have some time set aside for questions altogether. So we hope that will spark some meaningful discussion from this important topic today. So I know we'll continue to hear that lovely little noise that lets us know more people are joining as we get started here, but I will go ahead and introduce our topic for the day. So our topic this morning is supporting justice-involved individuals, reentry and beyond. And we're so excited about this very timely topic that is related to the waiver 1115 work, and to hear more about all of the wonderful initiatives and everything going on related to it. So our learning outcomes for today is to learn about wraparound services offered to justice-involved individuals leading up to and after release by a community-based reentry organization. That'll be the STAR project. We're also going to learn about wraparound services offered to justice-involved individuals during incarceration and after release by a managed care organization, which will be Molina. And then finally, we want to identify models of success for cross-sector collaboration that provide support for justice-involved individuals, which is something that all of our presenters will touch on. So I'm excited to introduce our agenda for today. First, we will have Mr. Tyron Nixon from the Healthcare Authority, who's going to present to us about the 1115 waiver work. Then Linda Scott and Elizabeth Rice from the STAR Project will talk to us about the wonderful work that their organization is doing. Curtis Lutz from Molina is going to talk about the reentry services from managed care organizations, and then we'll have some time for question and answer. And before we at the very end, we'll also have a chance to give some feedback on the day. And I always like to share that link right now, because I know some people may have to jump off the call early. So I'm going to put in the chat the link for the post survey. So hopefully you'll get a chance to give us some feedback after today's presentation. But with that, I'm going to introduce Tyron Nixon, our first presenter. Tyron is the Medicaid Reentry Transformation Implementation Manager for the Washington State Healthcare Authority, and he leads the Medicaid Programs Division's 1115 waiver reentry work. He has a broad scope of Medicaid work that includes maternal infant health, adolescent, youth, and young adult, and Medicaid administrative claiming, where his work with tribal governments has led to substantive increases in tribal MAC participation for Washington State. He is deeply committed to health equity, diversity, equity, inclusion, and belonging, which is reflected in his leadership role in the HCA's pro-equity anti-racism activities. In the community, Tyron is an active volunteer helping individuals navigate social services and supports, such as applying for Medicaid, reentry, housing supports and assistance, and addressing food insecurity. So thank you, Tyron, for being here, and I will hand it over to you.
Absolutely. Can everyone hear me okay? Give me a thumbs up. We're good? All right, perfect. Well, good morning, and thank you for that introduction. Again, my name is Tyron Nixon, and I'm the Transformation Implementation Manager here at the Healthcare Authority. My role is to spearhead the management of the internal and external work streams, just as Danny was talking about, specifically with the waivers, community-based care coordination, our waiver policies, reentry, and support of health-related social needs within our Medicaid delivery system. And truly, it's an honor to be here before you today. My purpose is to talk about Washington's Section 1115 Medicaid demonstration waiver, the reentry services and services in terms of what is on the horizon. So if we could go ahead and change over to slide 2. Thanks, Danny. So to set the stage, what is Section 1115? Section 1115 comes from the Social Security Act, but how does this work with Medicaid? Medicaid is a state and federal partnership, and the 1115 demonstration allows the Federal Secretary of Health and Human Services to approve experimental pilots or demonstration projects that are going to likely to assist the promoting of the objectives of the Medicaid program. If we look at this in terms of governance, under the Health and Human Services is a entity called the Centers for Medicare and Medicaid Services, or CMS. That's the federal authority that oversees Medicaid. So the purpose of these demonstrations is to demonstrate and evaluate state-specific policy approaches to better serve Medicaid populations. So in terms of the 1115, the MTP 2.0 that we're calling it, the Medicaid Transformation Project, is a demonstration waiver between the Healthcare Authority and the Centers for Medicare and Medicaid Services, or CMS. And so the MTP 2.0 allows our state to create and continue to develop projects, activities, and services that are going to improve Washington's healthcare center. Now, as we pivot over to slide 3, our 2.0 waiver builds off of our first waiver, which was for housing and employment supports. And it's a program we call Foundational Community Services or Apple Health and Homes. So our MTP 2.0 helps Healthcare Authority to widen our reach to provide more programs, services, and supports to our most vulnerable populations. For example, in applying for 2.0, we aimed for 3 areas. Number 1, ensure equitable access to whole person care, build healthier, equitable communities with our accountable communities of health, or ACHs, pay for integrated health and equitable value-based care. But how would all of this be accomplished? Our goals were really simple. Number 1, expand coverage and access to care, advance whole person primary, preventative, home, and community-based care, accelerate our care delivery system, and our payment innovations focused on health-related social needs. And all of this led to new or updated programs. For example, our continuous Apple Health enrollment is new. If you look over in the my right side, but that's going to be continuing. Long-term services and supports, LTSS, needs. That's a new program. Tailored supports for older adults. That's something that's going to be continuing. So this waiver allowed us to continue and also expand. And as we pivot over to the next slide, what's important for this meeting here is our reentry or justice involved individuals, those that will be leaving carceral settings and going back into the community. The big overarching question, I would say, Tyron, wow, that's a lot of information. That's a lot of work that has happened over the years. How in the world did we get here? And if you look at this slide, I won't read through it all, but this was something that just did not happen overnight. There were a variety of legislative acts that helped get us here. For example, I'll point out just a couple. The first one, Senate Bill 6430, back in 2016, that required the continuity of care during incarceration using Medicaid suspension rather than terminating Medicaid eligibility to reconnect those with the established managed care organizations. That's one. Another one I will pull out would be Senate Bill 5380 back in 2019. It was the state opioid response legislation that required the Healthcare Authority to pursue the possible 1115 waiver for medication treatment for people with opioid use disorder while in jail or in prison. So again, a few legislative acts that help get us to where we are. So now let's move over to the next slide. What's important again for this meeting is the new Justice Involved Reentry Initiative and the health-related social needs. Washington State was the second state in the nation to have our 1115 waiver approved. And this approval occurred last year back in June 2023. And so the question on the floor is, okay, why is this second in the nation 1115 waiver approval important? Why is this waiver approval important? For 2 reasons. First, let's move over to the next slide, Danny. Beginning July 1 of 2025, Washington State's Medicaid program, also known as Apple Health, will pay for a targeted set of pre-release services for Medicaid eligible adults and youth in Washington state prisons. Let me repeat that again. Beginning July 1 of 2025, Washington state's Medicaid program, also known as Apple Health, we're going to be able to pay for a targeted set of pre-release services for Medicaid eligible adults and youth in Washington state prisons, our jails, youth correctional facilities. So within 90 days of release, the objective is to facilitate access to essential healthcare services and case management to enrollees while incarcerated and allow those beneficiaries to establish relationships with community-based providers from whom they can receive services upon reentering into the communities. So these pre-release services include care management to diagnose, care management to treat, stabilize individuals, to address service gaps that may exist in our correctional facilities, provide treatment to control qualifying conditions, Medicaid changes, for example, to prepare them for release, including providing behavioral health, clinical consultations, services that are going to be focused on mental health. Also, medications for alcohol and opioid use disorder, hepatitis C, and HIV. Also, a 30-day supply of medication and medical equipment at release. This is going to be our North Star. If we can get the have the 3 mandatory ones performed, that will be great. So let's take a look at some more. Over on the next slide. This also includes lab and radiology, other supports for re-entering, coordination include, I mentioned earlier, durable medical equipment, services by community health workers with lived experience, and physical and behavioral health consultations as needed. Secondly, why is this important? Well, if we go over to the next slide, the approved 1115 waiver is important because reentry helps Washington state focus on whole person care. The waiver provides for post-release services where the focus is going to be on health-related social needs, or HRSN, or social determinants of health. We're looking at housing transition navigation services, whereby we're assisting or providing support on housing applications, benefits, perhaps even working with the landlord. We're looking at rent, temporary housing for up to 6 months, nutrition supports. There's respite care as well. So how we are envisioning this is 90 days prior to release, Medicaid eligible participants will be able to receive those medical services. Then at release, we're expecting a warm handoff. Warm handoff means so many things to people, but this warm handoff to a community-based organization. Like our accountable communities of health for those health-related social needs. And so a couple of things that are going to be important in this is trust, relationship building are going to be paramount as that process happens. So bottom line, the goals of the reentry initiative is to facilitate those linkages with post-release providers, including establishing those relationships that I was talking about between individuals and post-release physical and behavioral health providers, the delivery of the targeted services 90 days prior to release to stabilize and treat common conditions, reentry planning with connections and warm handoff. Also, it's important that we have that greater continuity of care through care coordination and access to medication pre and post-release. Overall, this is important to improve health outcomes, reduce rates of recidivism, emergency room usage, and overdoses and death. Quite a bit that is there. So let's go over to the next slide. As we pivot here, what are the requirements for this? And so let's now pick up the story. I'm trying to remember the guy's name. Many years ago, he used to be on the radio, and he was saying this amazing opening. Then he say, "Now for the rest of the story." So some of the older ones that are in the audience, I think his name was Paul Harvey. Yep, keep me correct there if his name was Paul Harvey. But now for the rest of the story, we've been working with carceral facilities and meeting with entities for the past couple of years. We have a legislative group that was put on or legislative directed. It was called our Reentry Advisory Work Group, and some other things that have been happening over the years to participate in this reentry initiative. We've been talking about it. Funding had been released by the Centers for Medicare and Medicaid Services, and those funds were approved by our legislature. So it was time that rubber meets the road. So going over to the next slide, the Healthcare Authority on April 23rd of this year, of 2024, we invited carceral facilities to participate in Washington State's the Reentry Demonstration Initiative. Now, this invitation included a letter from Dr. Fatinos, who's our state Medicaid director. It was a letter that invited all carceral facilities to participate. It provided an overview of the Reentry Initiative. It also included an intent to participate form. We asked facilities to complete, and this form basically served a couple of purposes. For one, we asked for basic facility information, for example, what county or jurisdictions they were serving, contact information, and to let us know where if they will be participating in the initiative. Now, participation in the initiative is voluntary, and facilities could choose to participate in one of 3 implementation cohorts based on readiness to perform those pre-release services that I mentioned before. Facilities must meet these milestones, and when they meet milestones, they have a contract with the Healthcare Authority, and we're releasing capacity building funding to them for every milestone that is met. For example, submit a letter of intent that lets us know that you're going to be participating in the initiative. There was a funding release for there. The next milestones that facilities are working on now, it was completing a capacity-based application, which includes really a set of expectations describing the facility's plan, looking at a budget, but basically it's really helping us to see where work needs, what are the gaps out there, trying to determine the facilities, what are the supports for those pre-release services that are going to be needed. Then next year, about early part of next year, what we're going to be doing, or right by spring, we're going to be looking at a readiness assessment, whereby the facility's current or planned readiness to support those pre-release services. We're going to be taking a look to make sure that all facilities are ready to go, but also submit an interim progress report, submit a final progress report are also part of this as well. If we go over to the next slide, I believe this one should show, yes, perfect. Here's a better, I would say a picture here that talks about, or a visual that shows when we talk about cohorts. We have cohorts 1, 2, and 3, and from the top left to right, you'll see the 5 milestones: intent to participate, capacity building application, implementation plan, readiness assessment, and the reports. The first cohort, the first group of carceral facilities implementing the reentry initiative will launch and start billing Medicaid on July 1 of 2025. If the facility elects to participate in cohort number 2, this is going to be the second group. They will be able to start billing Medicaid January 1 of 2026. And if the facility elects to participate in cohort 3, the third group of this, they will be able to launch and start billing Medicaid July 1 of 2026. So you see the schedule there, and I won't walk through that. I believe this PowerPoint is going to be presented to everyone, but you start to see the go live dates there. So again, the submission of materials allows for fund distribution based again on readiness. So when we talk about readiness, let me go here. I'm going to go through the next slide here. We have 42 facilities intending to participate in cohort 1. And we can read off just a few of them. Benton County is there, Chehalis Tribal Jail is there, Clallam County, Coyote Ridge Correctional Center from DOC, DCYF is participating with Echo Glen and Green Hill. If we go to the next one, we'll see Enumclaw Jail, Grant County, Grays Harbor, Kitsap, Kittitas, we got Klickitat, Lewis County. Next one, I think we have a couple of more. Linwood's there, Mason County, Mission Creek. We have Ponderay, Pierce County, Puyallup, Snohomish, Spokane County, and the Geiger Correction Facility. And then the last one, we have Spokane, Wahkiakum, Washington Correction Center for Women, Whatcom County Jail, and Aberdeen. So we have 42. And it's really, really great to see. But again, I want to caution everyone, while we're advancing the work and while there's enthusiasm, it's essential that we are mindful of this, because not all 42 may be ready. That's what we're working on now. So to making sure and helping facilities meet critical milestones to demonstrate readiness. So it's possible that some facilities might need a little more time, those that signed up in cohort 1. And if you need to move to cohort 2, that's great. Again, we want to make sure that everyone is ready to go whenever the live date goes. Either it's going to be July 1, 2024, or January 1, 2026, or July 1 of 2026. We want to make sure that the entities are ready. Let's go over to the next one. So what does a facility need to do? Number one, ensure that a client can receive those targeted pre-release services that we talked about, the case management, medications for alcohol, opioid use disorder, that 30-day supply of medication. Number two, adopt an electronic health records that support Medicaid billing. And so there's going to be a little backdrop here, but there's going to be an opportunity to participate in what we're calling here at the Healthcare Authority a Healthcare Management and Coordination Center system, HC Max, and that's going to help entities to implement electronic health records and Medicaid billing. And so for context there, this is something that the state is purchasing to help along with this the work that we're trying to do here. So we have the case management, medications for support, the 30-day supply. And if we go over to the next one, the next slide here, HCA, we have a supportive role in this as well. And so looking at some of the things that HCA is going to support. HCA, we're going to help in the establishment of a provider network for each of the facilities, provide or help in the case management portion, support administrative activities such as client eligibility checks, provider enrollment and billing support. And at each facility's discretion, HCA will be able to or can reimburse existing providers and staff that support any of the above activities. And so another thing to mention here, additionally for support, HCA plans to use a third-party administrator to support the application support for providers, enrollment, billing, claims clearinghouse, if you would. So HCA is going to be responsible for this TPA, but that's something that we'll be using as a tool to help in this entire system. So overall, why participate? You can get reimbursed for providing pre-release services for Apple Health eligible youth and adults, receive administrative support to deliver those services, and really just take advantage of the electronic health records that we have and have the ability to bill for Medicaid. So if I pivot to the next one, and I'm going to stop here before I run out of time, Danny, this is going to be a big lift for the Healthcare Authority. We cannot do it alone. So in conjunction with the invitation, there were other parallel meetings that were happening, and I want to highlight a few. And if we could turn to the next slide, our partnership with the Department of Corrections, aligning our activities and work with them. Our partnership work with the Washington Association of Sheriffs and Police, or WASPIC. That has been instrumental because we've had several meetings with them to get on get the word out platform to help reach those jail commanders to talk about the work that we're doing here. And I know they may not be on the phone. I want to say Kirk has been probably a part of it, but let's just a different Kirk, but we had Mark Stern and then we had Rick Bishop, all have been instrumental in this. I want to highlight our work with the Department of Children, Youth, and Family. We're working with them to align our efforts on the reentry initiative because they have Echo Glen and Green Hill that are going to be participating. We've been working with juvenile detention facilities to align our work. Managed care organizations, shout out to them. They have been really instrumental in this here because I know we're working with them now. We have a monthly meeting with our MCOs, but we're looking to move that back to bi-monthly. So as we start getting closer and closer to our directions, not our directions, but as we start getting closer and closer to a lot of things that have been determined, we want to make sure that we're working with them so they have everything that they need when we say go or before live hits, we'll be able to work and just move right ahead along with this. Another entity that's been instrumental that I have to account for, that's been the Accountable Communities of Health. They've been instrumental. But overall, I met with several boards now, counties, commanders, jails, and community-based organizations. And the main question that comes up to me is, Tyron, looking ahead, the main question that comes up is, how can we help? And I think the commitment is to ensure that the work that we're doing is going to be human-centered. How is it going to be coordinated, transparent, equitable? Healthcare, you see that we're working on that part. We're working on access to the primary health, mental health treatment, medications for opioid and alcohol use disorder. But one thing that comes up talking with those with lived experience, hey, don't forget about employment. Once we do come back into the community, are there places or avenues to have that meaningful living wage job? How about housing? How about is there increase in safe and affordable housing out there? How else folks can help raise their awareness about the program and influence how resources are directed? Talk with our legislators about supporting the innovative reentry programs that are happening all over the state, and with our tribal programs. We don't want to forget about the tribes because they are part of this with us as well. And if you're not already doing so, give voice to those that are currently or formerly incarcerated individuals with lived experience, to inform on our policies by allowing them to speak at various meetings or council meetings, because their experience is the expertise. Collaborate with state reentry councils. There's a variety of things that are happening out there. So in close, there are two stories that are happening here, and I don't want to get on my soapbox. This isn't what this is for, but one is about the science of policing, which is about what? Public safety. Housing, when you talk about healthcare, a livable wage job, all these are not being soft on crime. They're about following the science to create public safety for all Washingtonians to reduce that recidivism. But the second part of this, the second story, is about those with lived experience, those that we're helping. How does the program or the work that we're doing get individuals the help that they need, especially for healthcare? And so, with that said, I'm going to stop here because I don't want to go over my time. Am I still doing good, Danny? Am I still good on time? Okay. Yeah, because it's been really great to listen and hear those with lived experience. We know that there's domestic violence. We know that there one or both parents could be incarcerated. We heard about the single parent homes and the homelessness and things that they're coming back into. Again, the work that you're doing and the work that we're doing is key to help individuals have an ease back into the community. And with that said, I'm going to stop and open it up for questions. I think I still have time. I hope I didn't go over my time, Danny. Thank you.
Yeah, absolutely. We have time for questions. So if you would like to raise your hand, or you can put them in the chat, we would love to hear what questions you have for Tyron.
Wow, I'm amazed. You fit so much information into a short amount of time. That was really excellent. And you hit it right on the head as far as like what questions we have is always like, what can we do to help? How can us as an ACH, we have 7 carceral facilities participating in this, like how can we wrap around them? So I appreciate that it's acknowledged by the healthcare authority on, everyone does want to help and does want to make this work. So fantastic.
Thank you, Nicole. That's great. Thank you for that.
I know my peers, I know my powers above me are gleaming. They're just ear to ear. Becky, you usually have a ton of questions. I'm surprised you're quiet.
I think everyone's probably heard about Spiel, but one of the things I've been doing worldwide, not a worldwide, but a statewide tour, and I've bbeen visiting the ACHs and MCOs, and I know Shaban, I thought I saw her earlier. Maybe I'm just thinking because Shaban, if she's on here, she's fabulous to work with. So I'm trying to get out to her area. And Nicole, I'm trying to get over to Greater Hill. So you'll be next because I visited John. I still got to get up to Liz. I've been with Allison. And I know JP and I keep missing each other at Choice, but I plan on being over there because we have staff that are coming on to my team, and I want to make sure that they get to see it in action. This is a great partnership that is going on. This is how we want to grow up to be like you in a way. So this is what it looks like. And so that should be coming real soon. Thank you.
Tyrone, this is Becky from Greater Health Now. Yeah, thank you for this presentation, and your reputation precedes yourself. Yes, you're beloved and well known throughout the ACHs. My question for you, and maybe you can just put on your broader healthcare authority hat. What does success look like in the reentry initiative? So if we had to tell a story 5 years from now, what in a kind of an elevator speech, what does success look like?
For me, what success look like as I see the commute 2 ways. Number one, we talked about the process of going into 90 days to have the case management going. For me to have that oil machine whereby the jails, all of our carceral facilities are working, that process, the handoffs, those touch points is running smooth. Once that happens, then that transfer to the community organization. How is that continuity of care moving along? The hubs that are being built and established right now, how is that working? Because we saw the nutrition supports, we saw the rent, but what else? I'm thinking so like a spoke and hub model. Is there anything else that could be connected to that in order to get the individual's help? For example, banking, legal services, employment. How does all of that start to work in the amalgam of everything? I would say if that machine is moving and we all are in synergy and we know and we're working together, MCOs, ACHs, community-based organizations, our community health workers with lived experience, that we're getting individuals out there, that will be one. But the next thing, I don't have that number with us, but Washington State has been moving down in recidivism. I believe it was a big jump. I got to get that graphic, but we've moved down. If I could see that number even go down further, to say that what we're doing here matters, I would say, put my 2020 vision goggles on for 5 years from now, I would say that would be success to me.
Thank you. Thank you.
Absolutely.
Tyra, we have another, Emily has a question. Is dental covered service?
Yeah, that should be a part of the case management. Yes, definitely.
A really good question though. I mean,
Yeah, that
especially
is exactly.
dental and vision. I saw like a meme the other day. It was like, who decided that your vision was separate from your health coverage, like coverage or your dental? It's like, oh,
That's a great question. And thank you for that, because that's one thing, you know, to really put out, because I know we have Hep C, HIV, but yeah, definitely something like that we can call out our physical health and behavioral health. Thank you for that.
Well, thank you so much.
Yeah, absolutely. I was about to say, see, I bored everyone to death and see.
You know, I'm sure everybody's
no, we'll
just
be asking you every month to come back for a recap.
yeah. And
That
we
is
will
great.
we'll have a little bit of time at the very end if you're still if your wheels are turning thinking of a question for Tyron or one comes up, you can ask it at the very end. But I am going to go ahead and move us forward and introduce our next presenters. Thank you again so much, Tyron. We really appreciate it.
Absolutely. Thank you.
So I'm pleased to introduce two representatives from the STAR project. Linda Scott, as Executive Director of STAR, Linda continues to demonstrate exceptional dedication to and resilience in her role. Her compassion for our justice-impacted and community members is never waning. Her deep commitment to fostering positive change is evident in everything she does. And Linda advocates constantly for visibility of the issues faced by individuals impacted by the carceral system. So we are so pleased to have Linda, and she's joined by her colleague, Elizabeth. Elizabeth's background in advocacy and community empowerment lends a wealth of knowledge and insight to her role as a development and strategy consultant for nonprofits. She leverages her expertise in human resources and organizational development to assist nonprofits and social impact corporations in building capacity to dismantle barriers and design sustainable solutions that uplift marginalized communities. So really just the power team here from the STAR project. I'm going to turn it over to them to both share their screen and share with us about the work that the STAR project is doing for justice involved individuals.
All right, Liz is working on this. There we are. So, hello, I'm Linda Scott. Thank you for being here today. Really appreciate the time that you are taking to learn more about reentry services. So I'm going to tell you a little bit about the STAR project. We have been in existence for about 20 years here in the Walla Walla community. So we're not new to this. We are kind of in a period of transition. So as many things change, and a lot of things changed during COVID, we had a bit of an opportunity for a reboot about 2.5 years ago, and that's when I came on board. We have always looked at helping people, you know, reintegrate into the community post-incarceration. Originally, we started working inside the facility here at Washington State Penitentiary. And then that changed shape and we became a mostly community-based organization. And I say mostly because one of the things that makes us unique as a reentry services organization is we actually have the ability to reach inside as volunteers and start working with people wherever they're at in their reentry journey. DOC has a saying that says reentry begins at reception, and we want to honor that. And people who are ready to make that change, we just help plug them into resources that can, support that. So one of the things with Star Project that really attracted me was just the ability to really have that community impact and starting to build community before people leave a facility is super important and a key indicator of success. I worked in education inside the prison, and that is kind of where I started with my base of knowledge. And then I learned about the transition from people that maybe weren't successful at it. So being informed from people that are going through and have gone through the process is essential to the work that we do. We can look at the data and the statistics. And on the screen right now, it talks about, state average is about 30.7 for people who return. And our current average is about 5%. And that's looking at that same 3-year period of time that the state uses for their numbers. So having support works. So at Star Project, we pride ourselves on doing those wraparound services. We are very much a housing first model, because if somebody doesn't have a safe and stable place to live, their odds of reverting back to past bad behaviors are significantly greater. So to that end, we have a lot of relationships that we've built with landlords and other organizations. Here in this community, we do have a direct reentry house. And then we also have 2 independent living facilities as well. And I should just say they're apartment buildings. I wouldn't call them a facility. So we operate those as sober living spaces for a lot of people in recovery. And just basically honoring that transition and all the different skills that people need to build. So we're very supportive in those spaces. We help with basic needs. We have a recovery community that is specific to justice impacted people. We work really closely with behavioral health organizations here in town, as well as employment and education, and family reunification. That is key as well. In line with just really how we honor lived experience, we really work with our people as long as we can, right? We're building community. The story here is Caitlin, and she used our services when she first came back to the community, came to volunteer with us, and then she sat on our board for a little while until life got a little busy with that little person she has. But that's what we want to see. And she helped informed a lot about how our women's and children's programs work, right? Because that is something that is critical as we're looking at justice impacted people. That's not just the person who was incarcerated, that is their whole support team, right? That is families that are trying to learn how to best receive their person back and how to make things work with this person that has come back changed and continues to want to change. So how do we do that? A current program that we are working on too is, I heard financial literacy mentioned. We are actually working on a financial coaching program that is specifically targeted to justice impacted people. So it's something they can be working on in the inside as well as the outside. So it's kind of the ability for people to develop the same language around money and finances, because it's one thing for a person inside to be getting all this knowledge and education and learning how to change themselves and maybe learning about finances. But if there are people on the outside don't have that same education, there's a gap. And so that is one of the things that we do, is really identifying those gaps. And because we have the ability, I'm going to say we're in the penitentiary at least 2 or 3 times a week, meeting with different groups and supporting different programs that are happening. We have expressed permission to share Stephen's story, which is it's not unusual. In terms of, you know, we build up enough trust with this gentleman that he's like, please share my story. And I will let you guys read this. I will give you a couple of minutes, and then I'll tell you a little more about Stephen. So one of the things, well, there's a lot that this doesn't say about Stephen's whole person, but it does say a lot about what happens when people learn basically what things are named and the experience that they've been through. Stephen has done a tremendous amount of work on himself. He grew up in the system, right? But he's taken advantage of some educational programs and opportunities and is making a big difference for everybody around him. He was the teacher's assistant for the HVAC, so the heating, ventilation, air conditioning, which is not an easy program. He's been the TA for 5 years, right? He has got a heart for helping others. He is very interested in certified peer counseling and how that could be a pathway forward for people. His deep interest in that. And that has led to some education as far as like, what is that process? What does that look like? How can we bring that inside? How do we have that, that community helping community from the inside out? And that's also led to some education, because as we know, insurance can be a complex thing. So understanding that, and this is oftentimes when we go in and we talk about keeping people updated with current information. We've been telling them about, hey, this thing is happening. This is coming with the Medicaid coming inside and the services. So then we start finding out, okay, where's everybody at, and just understanding what these words mean. So that is so much of what we do, meeting individuals where they're at. And that means personal relationships in terms of just getting to know what is your story? There were a lot of gaps typically before someone became incarcerated. And then, you know, they gained, you know, hopefully some knowledge and some change as they were in the incarceration process and in programs. And what are those remaining gaps? So it's a lot of looking at that whole human who is a grown person. And as you can see, there's a lot of these areas that are kind of contribute to what makes transition challenging. So, and that's, you know, Stephen's story is, you know, he's been inside for 20 years. So there's a lot of these things. So when you think of barriers, just think about the cell phone you had 10 years ago, or actually just picture 20 years ago, right? Where were you at with any one of these things, and how do you jump out into the world? This is going to be Liz's next section, but really think about those things, because when we think about transition, we can look at that 90 days before and having access, which makes sense because you're closer, but the real work starts way before that in terms of that mindset and starting to educate yourself on what systems are in play and how they connect. When people leave incarceration, their transition time is forever in some cases, depending on the kind of trauma they experienced when they were inside. You know, average maybe about 3 years to start to feel some kind of normalcy. I mean, 3 years, right? That's more than just get these immediate things done, but that is just figuring out who you are in this world. So we proceed with a lot of grace. And as we're working with our community members, really education is start with that human in front of you and go from there. And that's what we like to do, is just work with everybody where they're at and build a customized plan and help people advocate for themselves as well. So Liz, I'm going to pass this off to you.
Perfect. As Lynn was talking about, I mean, I think that we can all identify, you know, in the work that we do, we come into contact with people who experience these barriers on a regular basis, right? We have this idea that we know exactly what the problems are. I want to just highlight it's incredibly important for us to know the strengths, right? When we approach things from a strength-based space and help people understand for themselves and for us to really understand this whole person, right? Who are they and what have they accomplished? What do they have on their life resume, right? Who are they and what are they going to bring into community? Because when we focused simply on the gaps, right, while it's important to fill those gaps, and this program allows us to fill the gaps, so just both at STAR and with the upcoming changes with being able to be inside and build for those services, it's critical, right? We're filling gaps we know exist, but we can't only highlight the gaps. Stephen is not just the 20 years of incarceration. He's not just the young man who doesn't know what he's walking into in terms of technology and change. He is a mentor, a board member, a teacher. He's a community developer. Every place he's been incarcerated, he has been the center of creating healthy, thriving, vibrant community. But if you are not engaging with individuals while they are incarcerated, then you're missing out on the opportunity to help them walk out into community in a way in which they retain their agency and their autonomy. So that 90 days to the gate is critical, but it's going to be a heavy lift if you're not also partnering with organizations or taking the opportunity as an organization for yourself to really build out the whole picture of this human, right? One of the critical things for Stephen and his story is that he designed a process of care for his fellow incarcerated individuals, right? He created systems in his units by which he could report care needs, where they could co-create community care spaces for things that were not being provided in their units at the time, and really being able to create a kind of a community advocacy opportunity didn't previously exist. And in doing that, this is a set of skills that he can take and advocate for himself. But I don't know about you, but for me, self-advocacy is often the more difficult of the path, right? That I can advocate for someone else all day long. Looking at myself and advocating for myself, I sometimes struggle to know where to step next. And that is, I think, doubly true when you're in a space where you don't have access to the internet, you don't have access to a real full knowledge of what you might be returning back into, and you're reliant upon people like us, people like you, to provide that information, right? If Stephen chooses wrong and chooses the wrong connection, he could really stumble when he gets out. And so one thing at STAR that we are focused on is that what Linda was talking about, this kind of whole person care and this coordinated care, right? So we focus on meeting our participants where they are. Oftentimes that means meeting them while they were still incarcerated. In our area here, Southeast Washington, right? We have Coyote Ridge Correction Center and WSP, and something around 40%, it fluctuates, of our entire state's incarcerated population is in those two facilities. And so we have deep connections in those facilities and are able to help coordinate connection for people that are releasing, whether or not they are releasing to Southeast Washington, right? We are not the primary location, right? Seattle and King counties, definitely you receive more than your fair share of people returning out of incarceration, but we are working incredibly hard to deepen our relationships with organizations across the state to make sure that when I'm working with Stephen inside, right, and I've learned his story, he's given me permission to share his story. We know about him. We've worked with him on finding new education pathways, on understanding what his real needs are for when he does get out. Where are the gaps, right? Some people release to incredible family support. Some people don't. Some people have completely estranged themselves from their communities and would be unsafe or could cause additional harm if they returned to their community that they were incarcerated from. So how do we help people navigate into those spaces? Because I know this all about Stephen, right? If I reach out to Tyrone and I say, hey, I've got Stephen and he's releasing to Pierce County, and I know you're there and your organization does great work. Here's all the things I've learned about Stephen. Here's how wonderful he is. Here's his gaps. Here's the things he needs to work on. Here's the support gaps he has, right? If we're able to do that, if we're able to partner with an organization in the place that Stephen is releasing, his success rate is going to be significantly higher. He's going to have much more opportunities to be successful. He's going to feel much more supported. In coordinating that care, we have to be really careful, right? We're handling people's important data. And so one of our kind of focal points is with our release of information procedures. When someone is engaging with us, initially, when we're starting with someone who's inside the facilities, right, we're just building a relationship, right? We don't require a release of information to build a relationship. But depending on where they are in their process to release, oftentimes it's some of the first questions we get asked is, oh, hey, we know you do release work in the community. We know you do reentry work in the community. What does that look like? Here's the things I need help with, right? There's a lack of resources. And so when you are a living, breathing resource in a space, it's oftentimes the first questions that are asked. As we start to be asked those questions, the first thing that we do is have them fill out our pre-release packet. Inside that pre-release packet is a blanket, robust but blanket ROI, right? In it, it lists out all of our very common partners that we work with, both locally and across the state, so that we can start to do some of the general level work, right? Where we can say, yes, we can talk to DOC, we can talk to the jail, we can talk to whomever. And in that ROI, there are also spaces for the individual to write in other people they might want us to be able to talk to. Sometimes people really want you to be able to talk to their mom because that's where they plan to release. And so in order to coordinate that housing and some of the needs, we need to be able to talk to a mom, right? Maybe it's a good friend. Maybe it's someone they met at another facility who was providing services in that area, right? So we provide agency in that ROI as well as like letting us know who your support network is or who you would like it to be. That blanket ROI lets us start to do that work. It lets me call Danny and say, all right, we have a release of information. We have Bob and he is releasing to your area around this date. Have you had any contact? Did you have any initial information? And we get to start to build that relationship and start to share out information. As we deepen the relationship, we will establish more robust ROIs with individual organizations, right? So if I'm asking to speak to a counselor, right, or a healthcare provider, there's much more specific ROIs and much more robust ROIs that we want to have in place to protect both our organizations as well as the data that was being shared. And so we will add to the stack of release information an individual one with that organization. This makes it so that as we are building out a plan for Stephen to release, or once Stephen or Bob has released, that they start seeing a counselor and say, yeah, I want you to be able to talk to my counselor to provide these whole person services, right? To help us wrap around and really support. Sometimes a participant will drop out of seeing a counselor simply because they can't get there on a regular basis and they don't know to ask for telehealth or they don't know how to ask for a ride. And so with that release of information, sometimes the counselor can just say, hey, you know, Stephen missed his appointment today. Have you heard from him? I haven't heard back yet. And we're able to circle around and just make sure things are okay, but also ask what other supports might need to be put in place to provide that service. When we're looking at the process from walking inside to out, so often we don't know what we don't know, right? So Stephen might not know exactly what he's going to need in community. It is incredibly easy for us as organizations to say, oh, we know you're going to need a counselor. We know you're going to need this type of housing. We know you're going to need a job. We know all these things, right? Tyron did a great job of listing out all of the areas of things that we might want to be aware of and providing supports in. Unfortunately, we can get overzealous in that, and as humans. And so as an organization at STAR, one of our primary goals is to build a therapeutic alliance and ensure that every relationship that we have with individuals who are pre-release and post-release is based on their priorities and their agency, right, in making those decisions. So with ROIs, we quarterly or more often review those ROIs to make sure that the individual can say, I no longer want you to be able to talk to my counselor. I needed that for a minute. I don't need it anymore. Right? I don't need that space. Or I really did need you to be able to talk to my mom in planning pre-release and helping me get safely into the community or back into her housing or whatever it might be. But this is now a boundary that I need to set, and I don't need you to be able to talk to that person anymore, right? Providing that connection to make sure that we have allowed the individual that we're supporting to drive the process is really critical. And it can be really difficult to do in a pre-release setting because everything about an incarcerated individual's day and life is very dictated, right? Very regimented. There are a lot of boundaries in which you have to work. And when you add in the additional boundaries of our professional boundaries and the services we can and can't offer, when you add in the gaps in communication and how we are starting a new thing, right? Adding in, hey, here comes the HCA. Here we're going to provide these different services. We can bill for these services. We're adding in this whole new set of rules and restrictions. It could become really easy to forget that the individual that we're serving needs to have that agency. And so building that into the process is, I think, going to remain really critical. In coordinating care, I'm just popping up here a quote from one of our participants as just the outcome from coordinating care. And this individual has now even just proceeded beyond this. She's transitioning out of our housing. She's been in the first healthy relationship she's ever had in her life. They're really fun to watch how they communicate and how they're just working really hard together to do so much healing and so much growth. But coordinated care is what makes that possible. Coordinated care is what makes an individual's process possible. If we are not looking at a whole person and knowing that as an individual or as an organization, we cannot provide every service. And that is, even if we could, that is not the way that community works. And so how are we modeling community to our participants? Well, one of the ways is by ensuring that we are working with all different agencies and coordinating that care, saying, hey, we are recognizing that this participant is getting ready to transition into these spaces. She's getting ready to transition out of our housing. Is she also deepening her relationship with her other community supports? What does that look like? Okay, as she's asked us to release information and no longer have contact with different places, like, are we checking in with her to ensure that she still feels fully supported, that she still feels that she has that community connection and that she's really truly built a life for herself and is flourishing? We operate from a housing first modality. And so that means that our first goal always is to ensure that someone has stable housing, right? We know, and there's so much science that backs up, without that stable roof, the rest of the supports don't really matter, right? It's really hard to gain traction in your mental health. It's incredibly hard to gain traction in a job and everything else if you don't have a stable home. And so we operate from housing first. Beyond that, and truly even within that, it's participant directed priority, right? So we might not agree that the house with 17 other young humans is a really safe or healthy home. But if that is your choice, our job is to just remind you that we have plenty of options. And should you change your mind, you can always come to us and we'll help you find options. But to respect your choice, that is your house and you're stable there. And then we move forward as we build that therapeutic alliance, as we allow our participants to have that agency, as we coordinate care across spaces, right? Hey, we're going to refer you to this mental health therapy. Hey, you are court ordered to receive a substance use disorder assessment. Here are the different options for how you could go about achieving that. Here's how we can support you in those places. Part of navigating that is a dedicated case manager, as well as dedicated peer support. So we ensure that people are locked arm in arm with a peer who's a few steps ahead of them or a few years ahead of them in the process, but has that same lived experience. And then we have a director of case coordination who just helps to make sure that all of the pieces are being looked at and that we're continuing to center our participants' agency and choice in every step of the way. So our question for you is just, as this new development continues to happen, how are you going to adjust as an organization to just better serve the needs of the justice impacted individuals that are in your care? Right? What does it look like to say, hey, we've got this great new option. We've got a great new option to provide these services, to receive reimbursement for these services, right? All those things are wonderful. And we're so excited about what can happen for the individuals that we're serving inside right now. Also, how do we make sure that their voice is centered every step of the way? I want to leave that to think about and open up for questions.
Yeah, Becky, take it away.
Oh, Liz and Linda, thank you so much. Your wisdom and expertise is so profound, and thank you for doing such heartfelt work. I am really curious on, as we're standing up and building the Greater Health Now hub, this regional hub, we are having lots of conversations about ROIs as we start to collaborate with our community organizations. So I was, I love the story that you told through Stephen's eyes. That was really helpful to show how this could really work and look. But with the ROI and, getting a sense of as a person takes on more of their agency coming out of reentry, what does that look like as far as, your case managers? Do they check in? Are they the ones that initiate that? Is this ROI still stand? Or do you find from your experience, is it more the individual saying, hey, listen, this ROI is null and void now? And is it revisited every time this comes up? I'm like, how, because this is certainly going to supplant our hub work. Like, how often is this an issue as people getting more and more autonomous?
Absolutely. So right now it's something that it's a little bit in flux, right? So we're trying it out. So it's every time I'm meeting with someone, because I am not their weekly visit, right? But every time I meet someone, I'm asking those questions. I'm checking in to say, is there someone else we need to be talking to, right? Is there someone else that you need to add to your support system, right? Who's your critical human? And would it be helpful for that person to talk to us, for us to be able to talk to them, for your support? And then the reverse is true as well. It sounds like you're kind of done with whatever it is, fill in the blank, right? Do you need us to still be involved in that space? So it's a little bit of an evolving process, but it is that question. One of the things that we've recognized heavily is that the individuals we're working with are so used to being told who they are, being told what they're allowed to do, being told what the rules are and how not to break them, right? So we think about so many of our individuals are becoming incarcerated as very young people, like very young adults. Oftentimes they've been incarcerated prior to that, or they've been in the foster care system, right? They've been in school, and in all of those spaces, you're told, right? You're told how to show up, you're told how to sit, how to speak, when to speak, all of those things. And so now you're here in free community and you don't really even know what that means necessarily, right? You have got big ideas about it, you have spaces there, but it's not my job to tell you what it means for you, but it is my job to continue to open up spaces for you to think about and make those choices on your own, right? You might not even understand that once you've signed something, you can rescind it, even though that's part of what we talk about as you're signing it, right? I make sure to highlight that. Do you remember? Did you believe me? Because we maybe didn't have a very deep relationship at that time. Did you believe me when I said that you could rescind it at any time? Maybe not, right? And maybe at that point you were too worried because I represent somebody who's providing you housing, or who's providing you access to a job or access to basic needs. And so that power imbalance is very real. And so it is my job in that space, it's our job as an organization to continue to ask the question. And it's not something that I necessarily ask every single meeting, just because it depends on the human, right? I don't want someone to feel unstable because I keep saying, I don't have to talk to people. I don't want them to feel discarded, right? So it's a little bit of a balancing act, but it is asking that question and reminding people that you are the only you that exists, and you are in charge of making your decisions for your life, because that is what allows people to truly change too, right? If I continue to treat you or talk to you in ways that you were spoken to as someone who's incarcerated, that mentality is going to stick with you. But if I can talk to you and encourage in every way that I talk to you, and every question that I ask, I can encourage your thought process, your autonomous thought process, and give you that agency, you recognize that you can exist that way in the world. So it is a little bit of an ongoing conversation. We've landed on at minimum, we're going to be having that conversation quarterly to say, hey, is there anything, formally, is there anything we need to change here? But it is something that we ask about a lot, because you as an individual, look, tomorrow I might decide that I need to switch therapists. And in that case, I'm going to make a decision and I'm going to move through the things and do the stuff. And that's true of everyone, right? What are my needs today may not be my needs next week, that my things might have shifted. And so how do we ensure that our support bubble doesn't hold somebody back, and instead moves with them and grows and adjusts as they need it to grow?
Thank you. That was a goosebump worthy answer.
What other questions do we have for the STAR project? One that's bubbling up, and I'm trying to think how to word it best, but for Liz and Linda, we have some community-based organizations on the call and healthcare providers who potentially aren't in your network just yet. Do you have any requests of them or recommendations for how to get connected to you, and any practices that you would recommend for them in general for working with individuals with that are justice involved?
So in terms of building connection, we build it the same way that you move into a new neighborhood and you walk around and say hi, or whatever your process is. We try to build those deep connections first with the individuals at each organization. So if we are not yet connected, we would love to say hi. We'd love to put time on the calendar to just chat about what it is that you do, and maybe what areas you're in, because we can also say, hey, we know people over here, and this is great. Let's get you connected there, right? So much of the work that we are doing, it ends up feeling kind of siloed sometimes, right? There's so many different players, and there's so many different agencies involved that sometimes it can be hard to know all the connections that you should have or build. And so the more that we can build that web of connection, I think the better off we are. So we'd love to definitely have that individual connection there. In terms of how you can build out some of these practices in your space, I think looking at your organization, your people, do you have the capacity to have someone who's starting inside now to build those relationships, right? I would say, please don't wait until June 1st to send people in. It does take time to build a trusting relationship where someone is going to believe the supports that you're offering, right? The nature of being incarcerated, whether in our Department of Correction or State Department of Corrections, Federal Bureau of Prisons or on the more local levels, is that a lot of times there are programs that are offered, there are things that are supposed to exist that for any number of reasons don't exist or get shut down, or a CO will tell you, here's the thing we're going to do, and I'm going to help you in this, and then that CO gets transferred, or something happens in the facility where the ability to provide that support goes away for that person. And so the trust building has to be really paramount, right? So what is it when you're building out your process, when you're building out the paperwork that you're going to have someone fill out, when you're building out your checklists, training your individuals for how you're going to deliver these services inside, or how you're going to partner with the jails that are providing services, make sure that that is a primary focus. Is how are we going to look at the individual in front of us instead of saying, here's your packet of paperwork, please fill it out. Okay, hey, your name's Bob and you live here and your release date is this, right? Like they get so much of that it's going to hamper your ability to actually provide meaningful services. And so when you're looking at all of those things, how are you approaching the individuals? And how are you ensuring that it's not just a name that you're checking off a list? Okay, I've offered them a housing space. I've helped them with a resume. I've done these things. Okay, great. Those are all good things, but did you help Bob with it, or did you just help someone on your list? Right? What does it look like to create that actual connection, that whole person view, and seeing them as a human and not an incarcerated individual? I know it's not a super specific answer, Danny, but was there
Yep,
another
that's phenomenal.
I think organizationally too, it's a very similar approach to how we approach individuals we're working with is where are you at, right, in your process of understanding this? What lens have you been looking through previously? And now you've got this whole other lens. So that's one of the things in terms of STAR overall and how we're building out our staff is everyone has some kind of either justice involvement or lived experience or something really adjacent, right? Like my background is in 2020, I went in and I taught adult basic education. So I got to learn the system at a really weird point of time, but it really allowed me to see things very differently because of the perspective I was looking through and how I was getting my information. We've got other people that have worked in other social service type organizations or in workforce development, working specifically with formerly incarcerated people. So when we look at our team, we're building out people that have a lot of experience in this space. And so we kind of bring that together. So in terms of an organization, look at your bench. Who do you have now and what's their experience? And kind of where do you need to start to build that understanding so that you can, as Liz says, kind of head off maybe some of those errors that could be made just because there was just some little piece that was missing. But in terms of that, as far as like, what are different carceral facilities like? What, kind of what's the day-to-day? And that's why we work so much with guys inside still too, is because I don't have that lived experience. They can tell us their day-to-day and what some of those challenges are from different perspectives. So I think that's it. It's just, inform yourselves best you can, see kind of where you're at. And as Liz said, we're happy to talk to folks to give you our perspectives and what we've learned.
Absolutely. Well, thank you both so much. We really appreciate those perspectives and your wisdom and knowledge. And thank you for your time today and sharing with us. And thank you for all the work that you're doing too. With that, I am going to transition us to our next presenter. And I'm going to go ahead and share my screen here and introduce Mr. Curtis Lutz. So Kurt has worked for 27 years, the last 17 years of which was as a facility commander at the City of Kent Corrections Facility. He worked for 6 years as the jail director at the Chelan County Regional Justice Center in Wenatchee. And then currently he's working on year 6 with Molina Healthcare. He spent his first 3 years as a health home care coordinator in Southeast Washington and over 2 years with the jail transition team. So we are so grateful to have Kurt today. And Kurt, I will hand it over to you.
Well, thanks, Danny. So boy, it's tough to follow Tyron and the STAR project. There is a lot of good information that they all presented. And I think what I would like to do is just share that there's 5 MCOs in Washington that are all doing jail transition, and some of them are on the call today. And we really do work pretty closely together and have very similar experiences. And so I would encourage any of them, if there's information to add, to please go ahead and please add that. I'm here just as a Molina person, but really to kind of talk about what MCOs do for the reentry project that we're all looking at. And I don't know, Danny, if you want to go ahead and go to the next slide. That just talks about why MCOs are involved in reentry. The HCA is mandated through contract that the 5 MCOs reach in to their members and assist with collaboration while they're in, and then assistance on the reentry part of them getting out. And we work with DCYF. We're trying to work with county juvenile. That's been a very challenging. There's been some real obstacles in that arena. DOC, and then also city and county, the local facilities, as Elizabeth talked about earlier. And one of the things Elizabeth talked about was really, I mean, it was really perfect, right? Spot on with treating people where they're at, helping them, seeing them for who they are. That was a really good explanation, Elizabeth, and just appreciate that. I think we're all kind of trying to do the same thing. Ours is a little bit more challenging. A lot of what we do is try to create relationships with jail leadership in the county and city facilities, because we really want to meet them where they're at and work with our members to not necessarily impact their operations as little as possible. We do a lot of work with visits, phone visits, video visits, in-person visits, but there's also some jails that really don't want assistance. They don't really want our assistance at all. So we try to mail information to members in those jails where we really haven't had any cooperation or a process set up that we can work with members. Some of the things that we try to work with the member is, you know, any resource stuff, anything that Tyron talked about in his list of services, resources, opportunities, and of course, anything medical related, pharmacy, DME, medication. And then we also try to assist those that need more assistance with food, clothing, housing, transportation for medical appointments. Some we've pointed and helped with employment, of course, substance use, mental health treatment, SUD treatment, getting ID cards. We've actually had some jails that have reached out to our staff and asked for clothing for them to get released in or to go to treatment with. We're also working with DCYF on the juveniles when they're getting ready to be released, or when they've gone into community facilities, because everything kind of changes for them at that community facility level. And then DOC, we work with DOC on reentry, and specifically on medical stuff, making sure everything's in place before people get out or go to their release point, so that everything's there waiting for them, so that they have everything they need. One of the opportunities for us is always to reduce recidivism. So we're always trying to get people back into services or into services with their doctors, with counselors, therapists. Um, our whole idea is if we can slow down the process of them going back to jail, that's what our goal is. Um, Man, I suppose I could go on and on, but with all the information that's been provided, it's kind of repetitive. And so if anyone has any questions, I'm all about answering questions. I could sit here all day and tell you stuff about things you don't want to know about. And so, if there's questions, please ask that. I'm much more of a in-person presenter. So I enjoy the conversation. And hearing none. Let's see.
Actually, Kurt, there's a
Yeah.
question in the chat.
Okay.
It's coming from Maria, and it says, Kurt, thank you for the clarification. I had a question about assistance available for incarcerated people when signing up for Medicaid within the jail. Navigating the website and understanding some of the questions can sometimes be challenging.
Oh boy. So that's something that our team doesn't really help with, but that's somebody else. But there are navigators for each county that can assist people signing up. And some jails, depending on the size and again, like Elizabeth talked about, some jails have more things available. Um, they'll help get people signed up, but I can help offline and provide maybe some other information, Maria, if that would be helpful. Or if any of the other MCOs have something that they want to add, please go ahead and add. All right, thanks, Danny. So, what does a day look like? So we every morning we get a list from the Healthcare Authority, each MCO, of all of our members that are booked into city and county facilities. And then we have staff spread all around the state that are responsible for each region, and they start working with that list of our members, reaching into facilities, setting up visits or appointments, trying to create that relationship that Elizabeth talked about. The sooner the better. Be that face that they recognize so that they know that we're there. They know that they can reach out to us when they get out so that we can assist them with whatever resources they might need. Again, Elizabeth talked about that, if you say it, you got to do it mentality, because it's really important. They've heard, in my previous life, they hear lots of things from staff and public defenders and everybody in their life while they're incarcerated, but there's not a lot of follow through. And so one of the things that we really stress with the staff is, if you tell someone you're going to do something or call them back, you got to do it, because that's how you build that relationship, that credibility with them, so that they will reach out to you or they will look to you for assistance once they get out. It's really challenging because when they hit the door of the jail, the last thing they really want to do is reach out for help. They're going to go back to what they did. And so it's important for us to build that relationship with them so that at least we're an option, and at least they're thinking about that when they walk out the door, so that we can help them. And like I said before, keep them out of jail. That's really the goal, even if it's 1 or 2 days more than it was the time before. Then we look at that as kind of those small successes because it's a very challenging time in their lives also. Danny, I knew time would be short. There was so much information before. I just hate to duplicate and would offer anyone, the other MCOs, if they want to add anything, and maybe if anyone has questions and they don't want to ask now, they can reach out. There is one more thing. I don't know, Danny, I sent you the flyer that we have. Oh, sorry, Becky.
Yeah, Curtis, thank you for being here. I just help me understand. And I admit I'm a little dense right now. Well,
No
always
problem.
probably. But if MCOs have had jail transitions teams, and historically someone maybe have got dropped off Medicaid during their jail, like how is the reentry initiative look differently for MCOs?
I don't know that it really does.
Okay.
And Becky, I say that because um, part of what we try to do is get everybody back on, right? And so if they're suspended while they go into jail, which is what happens right now, the waiver is trying to change that, is going to change that so that they have their coverage while they're in jail. But right now, they get suspended, and what happens is once the healthcare authority knows that they've been released, their benefits get turned back on to the plan that they were on when they came in. And so while they're in the incarcerated, we can still reach into them and have contact with the members to set that relationship up, to find out what their needs might be, to help them with resources. So as they're getting out, hopefully we can be there, or at least give them some information and direction on where to go to get those things that they need. So it's an automatic right now. The only people that aren't automatic are those that are long stays, and I don't know the breakdown. And I think Tyron might have left, but at a point, it's terminated, and they have to re-sign up. But most people that go into jail, they just get turned right back on, and it takes about 24 hours for those benefits to show back up once they're out. We also do work with jails to try to expedite that, especially for the pharmacy piece, so that if they walk out with a prescription, we're able to work with the jail staff sometimes. I should go back and talk about that. So that we can get that turned on so that as they walk out the door, they can go to the pharmacy and get their prescription. One of the other things that we do is some jails have reentry coordinators or staff that do a lot of reentry work with the members while they're incarcerated. And we'll work with that staff cooperatively to try to figure out how we can best fit and in the care or the resources or the needs for the member as they're getting out. One of the other things that we try to do is really figure out how to fit in. I mean, there's a lot of agencies doing a lot of reentry work. Some jails have pretty robust programs, and some have, next to nothing. And every jail is different around the state, which has been a real challenge. And so we just kind of try to figure how best to work in each scenario. So it's very, it's kind of like there's a saying, every jail is different in the state of Washington, and that's kind of our approach with each jail is, you try to meet them and give them what they need or provide what we can.
Thank you.
Did that help, Becky? Okay.
Great. I'd be happy to pull up that jail transitions program flyer. Is that what you want to do
Yeah,
at this?
if you want to, yeah. So that's
But-
something that, I'm sorry, Danny, that's something that she'll send out with the packet. And it's a way to get a hold of us. So this flyer is actually a flyer that we give to all the jails, and a lot of them have posted them on bulletin boards, have put them on their kiosks that they have for inmates that can order commissary, do other things. send kites requests like for medical or other things. And so these flyers are in a lot of the jails, city and county, DCYF, prison is DOC has used them or taken them. And so this is just kind of our flyer. And like I said, each MCO has something similar probably. And on the bottom is a email address that goes to a general email box that we can pick up. And then there's also a phone number so that if anyone has questions, they want help, they have a referral to the jail transition program, um, they can contact us that way. Or I would always offer, if anybody has any questions or has a referral or has someone they want some assistance on, just email me and we'll get that work done. And for referral to the jail transition program for our program, all I got to do is send an email. There's no form, there's no formal process. You know, reach out to us and we'll see if we can't get tied up and give somebody what they need. Thanks,
Kurt, would you
Danny.
say this is a fairly underutilized service through MCOs?
Yeah, I would from our experience. Part of what part of the real challenge is just trying to get the information to the members while they're incarcerated. Like I said earlier, there's some jails that have been really great to work with, and a lot of the smaller jails, they're having a lot of issues and staffing stuff going on, and they really don't have the opportunity to have extra things happening in their facilities. And so it's been really challenging to reach into those facilities. It's been really challenging to reach into facilities that don't have consistent consistent reentry people, because it's really hard to just get a hold of a CO and say, hey, here's who we are. Here's what we do. We're trying to get a hold of this guy. Can we talk to him? Very rarely does that happen because they're just trying to keep their doors open. One of the things that, all the experience I have in jail, it's been 6 years that I've been out, but when you don't have hardly enough staff to run a building, the last thing you want to do is anything extra. And so, especially for the East Side jails, the smaller ones, it's been a real challenge, and there's been some real hard work done with jail leadership to try to explain what we do and that, we're really there to be able to help them, and maybe keep people out of their facility a little longer each time. I mean, that's the goal. So I think, yeah, Nicole, it is. And the other side of that is there's so many other agencies that provide reentry and other services. The last thing you want to do is compete. And so what we're really trying to do is figure out how we fit in or who we can partner with or how we can partner or, how we can work with ACHs, which we're starting to have some meetings now to try to really figure out how that fits and how we work and how we can help assist with trying to get people what they need.
Right. That was my question. I remember when we had first spoken about all these services that are available to folks, it's almost like a mythical creature. I was like, what is this new? And you were like, no, like this is a thing. And how do
Yeah.
we get it so it doesn't just become a glossed over, great effort, but how does it so someone really takes advantage of this opportunity so it's not underutilized? Really, I want people to know that this is a service to them and it's available to them, and how do we maximize getting people to use it? And I don't see it as competition, but more adding to the wraparound services and supports, because there's not enough funding.
Yeah.
There's not enough services as we speak right now. So I would love to flood your phone with as many things as possible, and just understanding why people don't jump into this more often and take advantage of it, this opportunity. But as you said, kind of the process, if they're getting a phone call coming out right after they've exited, they're like, who is calling me? What do they want? Am I in trouble with my insurance company? Just
Yeah.
getting over that hesitation and be able to embrace a little bit more wraparound services. It's like,
And-
no, they're real people. They're real people.
Yeah, and that's the problem. You call and, hey, I'm with your insurance and I'm here to help. It's like,
Okay,
Okay,
yeah.
really? So that's really why we're trying to, do these in-person visits or telephone visits as often as we can, at least just to explain who we are and give some credibility to the program so that they might, um, so that there might be a chance that they'll answer the phone when they're out or that
Right.
they'll pick up the phone and call. More and more we're starting to get, I think as it was Elizabeth that kind of talked about the support system, right? The family, the friends. We're getting more and more calls from like moms now, their child is in jail and um they want help for them. But the problem is the child doesn't necessarily want help and it's an adult. Their child is an adult. And so it's a really difficult, but then that gives us an opportunity to reach in and go, hey, we might have heard from someone in your support system. You might need some help. What can we do to help you? And we have a very small form of trying to figure out what resources they might need when we meet with them so that we can kind of figure out what direction we need to go with them. Because sometimes you get 30 seconds of time to talk to them, and so you want to make sure that's as valuable as possible.
Right, and and channeling through, community-based or community organizations within the community that already have the trust is super important, like going through Linda and Elizabeth, or even any of our, community-based organizations, CAP agencies, housing apartments, no wrong door, quite literally, but you got a big name like Molina's, people are like, what does my insurance want? What do they want? But it's like,
Yeah,
no, like, here's Kurt. Like Linda's like, yeah, no, like they're here to support and to help, and having that
yeah.
open door. I think it's great to get the word out and kind of spread the
Well,
information of what you all do.
and what we're finding is a lot of a lot of people that I'm talking to now are like public defenders, probation officers. I mean, the wheel is starting to get bigger and, more people are starting to reach out and say, hey, I think you can help us. And so, it's just you go to every meeting, you talk to everybody you can because someone might know someone who then calls you back, or a group that you can talk to or present to or share your flyer with, or, it's just that's a lot of what we do is just kind of that spread the word, like you said, Nicole, trying to get people to understand, what's out there and what's available. And this working with ACHs is kind of new. I mean, it's been the last like 3 or 4 months that we've really started to have ACHs reach out to us and want to talk more. And I think the waiver is a big driver of a lot of this because jails have to do, you saw early on from Tyron, jails have hoops to jump and things that they have to present. The ACHs are in the local communities trying to partner and trying to figure out how they fit in. And then the MCOs are trying to figure out how they can fit in. And it's just this kind of layered approach that, I think once we figure it out, it's going to be awesome to watch happen. But it's, we're kind of at that point now where we're sort of figuring it out.
Absolutely. Figuring it out and then continuing the momentum and not just stopping at whatever barrier comes up. So I appreciate this communication, relationship building, and I can see Becky beaming over there in my corner. She loves making relationships with MTOs and everybody else under the sun.
Yeah, and and I just want to be really careful because I know there's people on this call that I meet with probably almost weekly from the other MCOs. We're constantly talking about jails and how can we and how do we and who's next, and it's a real put the plane, build the plane as it's flying kind of approach, because there hasn't been a lot of direction on what this looks like. We've been able, that's one of the things I think that attracted me to working on the jail transition team is we got to kind of build it as we're going. And so, it's just this relationship stuff over and over and over. And you go to a meeting and you meet someone new, or you meet Nicole who, wants to invite you to 100 different things and help with the program. And, that's what it's all about right now. And we appreciate it
Oh, and
wholeheartedly.
I've been so fortunate that he hasn't completely shut me down yet.
Nah, Not at all. I mean, at the end of the day, as the start, as Linda and Elizabeth both said, it's really about the person coming out. And, if you can get them what they need or help them get what they need, man, there's stories of wins, but they're few and far between sometimes. But it's the thing that kind of keeps everybody going. It's our why, because that's what we're all here to do. Is at the end of the day, it's all about those people coming out.
Yeah, we're so excited to share this information with our community-based organizations and our healthcare providers that are on the call, because we hope if you have a takeaway, it's that the person sitting in front of you is probably enrolled in an insurance plan that has these services that they might not know about, and so you now know about them and can help them get connected, whichever MCO their plan is with, help make that connection, and we're really excited to hopefully help drive some traffic to the jail transitions program.
And Danny, I think one of the slides that I gave you was contact for all 5 of the MCOs for the jail transition team. So that'll be sent out too. So, it's not just Melina, it's all of us. And, we're all kind of in the fight together. And I say fight just because it's like every day we're figuring it out. Thanks, Danny. And, I want to just say thanks to Danny and Nicole. We had some challenges with getting me to be a speaker today, and these guys both were troopers all the way through, and I just appreciate the relationship that we're building as we're going forward with all of this, and hope it just continues.
Here, absolutely.
Yes, thank you so much for your time, Kurt. We're so glad it worked out for you to be able to be here. And here is that slide. This slide deck will be sent out, so you will have access to these links and can connect as you need to. So we're really excited about that.
And there might be a new AmeriGroup contact. I know that they've changed. Well Point.
Yeah, they're WellPoint contact.
And I might have to update that for you, Danny. I'll get that and share that.
Perfect. That sounds great.
Thank you, guys.
Thank you so much. Well, we will keep rolling here. We have just a few quick announcements before we wrap up for the day. One of which being, I'm actually going to go past this slide and talk about our Connect to Everyone grant. So we are currently in the midst of our application season for the Connect to Everyone grant. And we are hoping that everyone on this call has heard about it already, but if you haven't, please know that this is available. It's for projects that'll take place in the next year during 2025, with a grantee amount of between $50,000 and $75,000. So all of our community-based organizations, we would love to see what sorts of programs and projects you're working on, especially that are focused on population health, access to care, nutrition, social connection, and workforce development. So if that sounds like your mission, and if you're unsure what that project or program might look like, get in touch with us. We'd love to help you brainstorm and develop something to get an application in by September 30th. So the QR code on here connects to our website and has a lot more information there. Yeah, I'll pause for questions. Are there any questions about that program before we move on? Great. Then our last ask is if you have a few minutes to just give us your feedback. There's a QR code here or the link I will put in the chat again. And we would love to have your feedback from today's session. Yeah, and people are starting to jump off the call here. That's how you know it's wrapping up when we ask for feedback. So but we'll leave that on the screen there and I'll get that link back in the chat. Thank you everyone for being here today. Thank you so much to our presenters. We really, really appreciate the depth of knowledge shared. It was so impactful, and we will see you all hopefully next month for our next learning collab.
Thank you, Danny. Whoop, whoop.